Great. Well, good morning, all. Feel free to help yourselves to refreshments throughout the day. My thanks to Eric and Sylvia and your teams for working so closely with Nadia and her team. And we really appreciate this opportunity to be here in New York and look forward to the day, both the general session and the breakouts. So as Nadia said, we want to fairly briefly review with you a little bit about the American Brain Tumor Association. I became president and CEO about a year and a half ago, in fact, and there's so much about the long and rich history of the organization and how solid and effective it's been, but so much more it can be as we work to support the brain tumor research community and the brain tumor patient and caregiver community, our areas of focus. So today, as you see on the screen, brief overview. I will be here throughout the day if you have questions. Nadia and Ambreen are here. Never hesitate to reach out and ask any question about any issue at any time. We'll talk to you briefly about our two major areas of emphasis, that is funding brain tumor researchers and working to support the brain tumor patient and caregiver. And then we'll share with you ways that we raise money to support our mission, and then at the end talk about how you can help. So the ABTA was founded in 1973, and our mission is to advance the understanding and treatment of brain tumors. And our goal is to improve, extend, and ultimately save the lives of those diagnosed with a brain tumor. It is a lofty and challenging goal, and we need to see a lot more progress. Well, how do we advance our work? Well, you look at the screen, you will see the areas of emphasis for us. And you could easily take the limited resources of any organization and make it so diffuse it's not effective. So what we've decided to do is to focus our work in areas to have the greatest impact and look at what other organizations are doing in this field. So if you look at our patient and caregiver support, our work in collaboration with other organizations, the unique public education and awareness that we do. And then we'll talk briefly about our research that we provide to those doing important work in the field. So, and I am moving through this so you can get to the main general session or the main panel here, and then the breakout sessions, but our mission really starts with our legacy. In 1973, when the ABTA was founded by two mothers who lost their daughters to brain tumors, their young daughters, the one thing that they realized that wasn't out there was an organization helping to raise money to fund brain tumor research. So over the course of these many years, our legacy has been to fund those doing brain tumor research and to help foster the next generation of leaders in the field. And I am really pleased that we have funded work in areas of drug development, precision medicine, imaging, immunotherapy, stem cell research, just so much that we have done as an organization that is making a difference. And that is really important movement forward. So our approach, what we do is an open call, peer review, competitive research. And so we want to both foster the next generation of researchers, and we want to fund high risk, high reward research, both those. And I will share with you the four panels. And in each one of these panels, we recruit volunteer scientists from all over the country to sit and serve as reviewers. And we eliminate conflicts of interest, and I'm really proud of the approach that we take, the money that we raise, that we invest in these four panels. So the first panel that we do is a basic fellowship. It's a 2-year, $100,000 mentored grant opportunity. And it is a really important way for us to foster that next generation of science leaders in the brain tumor field. Let me just put on the screen these are the first two. Let's see. So then we do the research collaboration grants, 2-year, $200,000 grants these are multi-institution, multi-investigator collaboration grants. And so we issue fewer of these, but they're very impactful and very important as we move forward. The next two are the discovery grants, and these are typically grants that allow someone to take an idea and prepare it in such a way that they can then make a grant application to the National Institute of Health for something called an R01 grant, which is a multi-year, very large federally funded research grant. And this discovery grant, in many cases, provides that research, that opportunity to do something in their lab to prepare that work product for the much larger federal grant. So we're very proud of our discovery grant program, and it is the largest of our 4 panels. And the final one, we're very proud of this also, of course, and that is medical students have many options, many career decisions they have to make, and some are quite appealing for many reasons. And so we want to give them an opportunity in a summer to work in a lab, and so we provide a summer fellowship. It's just for a few months during a summer to give them that exposure. And one of the highlights of my year and a half as CEO I was out at USC, and the dean of the School of Medicine arranged a lunch and sat with 3 of the most brilliant young people I've ever met. All 3 were there to tell me and tell those of us with ABTA that if not for the Summer Fellowship Research Grant, they would have gone into a different line of medicine. All 3 were going to be either clinicians, researchers, or both. And it just really was encouraging. So I want you to know that that's one of the things that we do, is to motivate those people in medical school to consider a career in neuro-oncology, pathology, radiation oncology, whatever. But this field needs new, brilliant talent. And that is one thing that we foster, that we create that awareness over a few months that is making a difference. One of the things that I do want to bring to the ABTA is a commitment to evaluation. So all of our programs and services will be evaluated on an ongoing basis. Are the programs achieving the results that we have set forth? So if you look at this summary slide, you will see, I mentioned our legacy is research. Those 2 young mothers who lost very young daughters to brain tumors knew that this field needed dedicated research. And so over the course of our time, we have funded $32 million in brain tumor research, 705 research projects, and 635 researchers have received an ABTA grant. And so we're very proud of that legacy. And I talked to so many people who say, I too, Dr. Solman, I believe, indicated he was a funded researcher early in his career, and so we want that to happen. And if you are from an institution, feel free to reach out to us. We will provide information about a very easy way for you to make application to our program, and it's an annual process. Another highlight of the American Brain Tumor Association is those formerly funded researchers we bring together as members of the AAARN, the ABTA Alumni Research Network. And as Nadia mentioned, we had our recent national conference, which is this over 2 days. And one of the things that we did differently, and Eric was saying that he is a member of AARN, and it's the first one that he missed, so I appreciate that commitment. And so we combined the AARN with the national conference. So what is the AARN? It is a 2.5-day opportunity for formally funded ABTA researchers or those currently being funded to come together, network, collaborate, literally sometimes write proposals together. Also, learn how to run a lab. Some of them are very young in their career, and there's a lot to running a lab, as some of you might know. So we really have a series of things that are both science and very practical business learnings that happen over these 2.5 days. And so you see there on the screen the publications that have come out from these groups, from the AARN members, and we had about 50 attend this past year, so very, very proud of that. Again, I'm moving through this quickly. All of this is on our website, abta.org. abta.org, as you will see in the bottom of the screen up there. In addition to our open call, peer review, competitively issued grants, we also collaborate with others. One of the things that we've done recently in January of this year, we joined 5 other brain tumor organizations. We pooled our money so we could fund larger grants. So in January, we funded $3 million with 4 teams of researchers. I'm very proud of that. That's underway, as you see, immunotherapy and primary brain tumors, both adult and children. And I really want to emphasize that our research is open to any age group and any tumor type. But the Brain Tumor Funders Collaborative is an example of collaboration. In addition, we have a low-grade glioma registry that we are funding. Let me move now to patient services. Nadia Spahn, who heads up that program, does a phenomenal job. She's raising her hand in the front here, and she's available in between everything. And so our website that I referenced there on the screen, we're here for you, for the brain tumor patient or a caregiver or family member. Our information will be accurate and timely and completely objective. Our only special interest is the patient, period. So this is a little bit about what's available. In addition, we have educational materials that are constantly updated. We just added a medical writer to our staff, and over the coming year or two, you're going to see our quality increase, and our commitment to you, the brain tumor community, is that we are here providing that information, and all of our services are completely free of charge to the patient and caregiver. We have a care line that's available to talk to someone who is trained, or you can do it via online services. Clinical trials. Too few brain tumor patients enroll in clinical trials. Too few. There are a lot of reasons for that. There are a lot of barriers and a lot of realities to the challenge of the disease, but we do have a free matching service. Feel free to reach out to us. We have online support community. Over 21,000 members are in our community. We have webinars once a month, all available, abta.org. We have these regional meetings. As Nadia mentioned, we have our national conference, which was the largest ever. It was a phenomenal event. We have peer-to-peer mentoring service. So if any of you have been through the experience and want a mentor, or if any of you need a mentor, let us know. Talk to Nadia, and she will explain to you the training we offer to those who want to serve and the service we offer for those who need it. You will see we have 200 trained mentors, and we have 600 that we've matched so far. So please, let's see. Next, how to get involved, and I've got to move through this quickly. I know my time is flying. So we've got fundraising events, our signature event, our walk runs called BT 5Ks. And we have one in New York City on November 10th. If any of you, I know some of you, John and others, are very active in supporting it, and we could not do it without many of you in this room. But please join us in this event. Maria Menounos was our guest speaker last year. I'm not sure who's speaking this year, but regardless, it's about the brain tumor patient, family, and caregivers. We also have a wonderful thing. We have one person on staff who works with anyone that wants to do a volunteer event. It might be a wine tasting, a small golf outing. We will help you create your own web page, your own process to a volunteer-led event. It's called, at the very bottom there, Fundraise Your Way. So we are always looking for volunteers. We have a small staff. We have hundreds and hundreds of volunteers all over the country and are always looking to connect to people who will give us some of their time. And I promise you, we will make your volunteer experience meaningful. We will help you be as effective as possible. So what are some of the volunteer opportunities? As I mentioned, we have BT 5Ks in 10 communities. Each one needs committee members. We have event volunteers, and then we need skill-based volunteers. For those of you who are not yet signed up, we have a monthly e-newsletter called Mind Matters. Free of charge. I would ask each of you to consider joining that. You will get it once a month to tell you what's happening, not just with the ABTA, but the big picture of, say, Optune being funded by Medicare, which was a big win that we had this month. So we're proud of the role that we played and what that means as an option for the physician and patient to choose. So look at the various ways to stay in touch through social media. So in summary, our goal is to mobilize the brain tumor community to make a difference in fighting this insidious disease. We have made some progress, but certainly far from enough. And our goal is to fund the innovative research and to foster the next generation of scientists. Thank you for being here. Thank you again, Eric and Sylvia, for the leadership in this program and the breakout sessions, and to Nadia and her team. Thank you all very much.